mental health services. We're going to be recording this session, so I hope that's okay with everyone, so that we can do the Mind equivalent of iPlayer and people can watch it back at a later date that aren't able to join live. I'm going to be co-presenting with Louise. Louise, do you want to just say a quick hello and introduce yourself?
Hi everyone, I'm Louise Dukes from the Regional Influencing Team at National Mind, working closely with Vicky and colleagues in the wider Policy and Influencing Team.
Thanks, Louise. And without further ado, I'm going to kick us off and share my slides. Can everybody see that? Any thumbs up? Much appreciated. Let's go to full screen. Okay, so this session is about tackling mental health weights together and exploring the role the VCSE and specifically local minds can play in helping end long waits for support in a very fast changing policy environment. Louise and I will be talking about this for about kind of around 20 minutes, and then we'll move over to you for some group discussions. So what we're going to cover today, first of all, is a little quiz on mental health waiting times. Then I'm going to talk a bit about the national policy landscape, some of the things that are happening following the publication of the 10-year health plan in the summer. Louise is then going to talk about some local mind examples of where they're doing work that speaks to some of the national priorities and the recent NHS medium-term planning framework. And then there'll be a group discussion on the opportunities and barriers for local minds in the current landscape. So first of all, on to our quiz. So could you put your answers in the chat to these? It's multiple choice. The first question is, what year was the 18-week referral to treatment waiting time target introduced for physical health services? Was it 1997? Was it 2001? Was it 2004? Or was it 2011? So A, B, C, or D. So I'll give you a few seconds to put something in the chat. Louise, I can't actually see the chat, so if you're able to feedback on what you're seeing coming through, that would be great.
Yeah, so there's a 2001 and 2004 are the most popular ones, and I think 2001 has the slight edge with 4 responses.
Okay. Well, the answer was actually 2004. So this was when the previous Labour government introduced the famous 18-week waiting time target, which was more or less met for a very, very long time. But the NHS has really struggled to meet that in recent years. So question number 2. The first waiting time targets for mental health services covered early intervention in psychosis, NHS talking therapies, previously known as IAT, community eating disorder services for children and young people. So what year were they introduced? So the 4 options there are A, 2004, B, 2010, C, 2015, and D, 2021. Louise, do let me know what's coming through.
Most answers are again for B or C.
Okay, all right. So the answer to that one is 2015. So it was a full 11 years after they were first introduced for physical health that we just got those 3 for mental health. They were introduced by the coalition government under Norman Lamb and have made a really big difference in us being able to kind of understand what waiting times are and how those services are performing. So on to the third question. So since then, how many additional waiting time standards have been introduced since those first 3? So there's been 10 years has passed. How many more waiting time standards do we think have been introduced? And the answers are A, 0, B, 2, C, 4, and D. We now have a full set of standards covering all services. When is it we're going into the new building? When is it we're working? Louise, what are our scores on the doors?
So I love Debbie's response because it's positive, but unfortunately, most people have said A, 0, which is correct.
Correct, absolutely correct. So unfortunately, no new waiting time standards have been introduced since then. So back in 2021, NHS England consulted on potentially introducing four new targets. So there'd be a 1 hour one covering emergency care, 4 hours for urgent, and then 4 weeks waits for both CYP and adult services. And NHS England does actually flow the data, which shows how many people are waiting for those services, but they've not fully introduced them because they've never had the sign off from the government or the funding to enable them to be delivered. So the reason we now have a bit more of an accurate waiting times figure for mental health service waits is because the data is flowing, but we don't actually have the standards. And as far back as 2016, for those of you who've been around, might remember that Paul Farmer was very instrumental, our former chief exec, in producing the 5-year forward view for mental health, and that recommended a full set of standards be introduced by 2021 as a crucial step towards parity. So question 4, how many people are currently on NHS waiting lists according to the most recent NHS data? Is it A, 1 million, B, 1.6 million, C, 1.8 million, or D, 7 million?
Okay, so the responses have been split between C and D. And over to you, Vicky. But I'm glad. All I'm going to say is I'm glad the D responses are wrong. I hope.
Yes, that's a relief. So it is 1.8 million according to the most recent stats. This is one that does fluctuate quite a lot. It was down to 1.6 million a few months ago. It has been up as high as 2 million, but at the moment it's 1.8, and around 500,000 of those are children and young people. The 7 million is the figure for physical health waiting lists, which gets talked about quite a lot in the media, but doesn't actually include all those extra mental health waits. So final question, how many times are mental health waits mentioned in the NHS's 2024 Elective Reform Plan on tackling long waits for care? And the options there are A, 0, B, 1, C, 4, and D, 18.
Okay, I can see a couple of people are still typing. Look. Yes. I'm with Charlie. I'd like it to be D too, but I think the majority of people are right again with this answer. The majority going for A.
Unfortunately, again, correct. So there are currently no national commitments at all to tackle adult mental health waiting lists. And the medium-term planning framework says that ICBs should tackle the longest waits for children and young people's community mental health services by improving productivity and reducing local inequalities and unwarranted variation in access. So there's some commitment within that, but within the actual elective reform plan, mental health was treated as just being completely outside of that because they were looking at consultant-led waits. So there's a real sense of a kind of two-tier approach to mental health waits. So I guess in summary, we can say that over the last 20 years, then mental health waits have rarely been prioritised within the NHS, but we know that waiting for support has a devastating impact on people's lives. So this is from polling that we conducted at the end of last year. 72% of our respondents who'd all tried to access mental health services in the last year said their mental health was negatively impacted while they waited for mental health support. 27% of respondents said they'd had contact with the mental health crisis team. And really shockingly, 48% thought about taking their own life while they were waiting, while 16% attempted to take their own life. So it's a huge gap and a blind spot for the government at the moment that they're not really taking these waits as seriously as they should do, and putting in those kind of compelling measures to actually kind of make sure that we've got clear waiting time standards and there's a plan to deliver them. What we've been saying in our kind of lobbying with government on this is that the VCSE have a really important role to play in tackling waits, whether that's providing additional capacity as part of community and crisis pathways through the contracted services that a lot of local minds already deliver, things like talking therapies, peer support, crisis alternatives, discharge support, and services that provide emotional and practical support in A&E that reduce admissions and detentions. They also provide that non-clinical early intervention for people with lower level needs to prevent them then deteriorating and needing clinical support. So all the things like early support hubs, supported self-help, helplines and advice lines, and information provision. And we also know the network also does a lot to help address the social determinants of mental health for people with an existing mental health problem by offering financial advice, debt advice, housing advice, supporting physical health, enabling social connection, providing employment support, helping people to connect with nature, lots of different ways that you can help to prevent people from relapsing and needing a hospital admission. So we think that local minds are absolutely critical to achieving this. So now onto a quick overview of the national policy landscape. This is a bit of a whistle-stop tour. And to look at, we don't have the waiting times levers that we'd like. They're not as strong as we'd like them to be, but there are some options, some possibilities within what is being proposed by government and the NHS to make some changes and make sure that people get care much more quickly when they need it. So for anyone who isn't aware, if you're in the policy world, this is all we talk about. Then the 10-year health plan was launched in July of this year, following 9 months of engagement with the public, with staff, and with health organisations, including Mind. And it aims to make 3 strategic shifts. Moving care from hospital to community, from analogue to digital, and from treatment and prevention. And the idea is that by doing this, this will fix the NHS, which the Secretary of State Wes Streeting described as broken, and improve public satisfaction because people will get much quicker access to better quality care close to home. Now, the reality is this funding situation isn't where it was 20 years ago when the previous Labour government was able to achieve some really kind of bold changes and really kind of get people much quicker access to care. So funding is going to go up over the next 3 years for 3% above inflation. That compares with 8% in the 2000s. And normally we'd expect around 4% is needed for a health system because health inflation is just a little bit higher than for other parts of the economy because there's always new and expensive treatments coming on stream that the NHS wants to be able to offer to people. I'd say the first 3 years of the plan is very focused on elective waits, urgent and emergency and GP access. But there are some opportunities for mental health within those 3 shifts and the national priority deliverables. So the plan sets out what those 3 shifts mean specifically for mental health. These are the commitments over the next 10 years. So 4 areas in community. One is setting up dedicated mental health emergency departments to ensure patients get fast same-day access to specialist support in an appropriate setting. So there's going to be some capital funding to enable them to be set up. I think the key things from our perspective is that they need to be very close to the main A&E so people can always get the physical health care they may need. And we need to make sure that they're covered by any kind of waiting time standard so people aren't kind of moved out of A&E and parked in a porta cabin in the car park, which we know happens in some places, and they're no longer seen as visible to the system. There's an intention to transform mental health services into 24/7 neighbourhood care models. It's a little bit unclear what this actually means. We already have had the community mental health transformation process over the last 5 or 6 years. So some of this seems to speak to those models, but it's maybe about going further faster with them. There's also a commitment to improve assertive outreach care and treatment to receive national coverage, but not until 2035. We know those services are really important to supporting people who don't engage well with services and making sure that they're kept safe. So I think we and probably NHS England would like to have seen a bit more ambition on getting those in place a bit faster. There's also a commitment to introduce a modern service framework for people with severe and enduring mental health problems, which would look at what they're talking about a moonshot, so setting a really strong ambition for what care would look like for that group, and then some intermediate objectives to get there. So we're having conversations with the National Medical Director for Mental Health about what that could look like. On the prevention side, there's actually a lot of activity, a lot of it around children and young people. So the government's committed to fully rolling out mental health support teams in schools by 2029. There's a commitment to roll out children and young people's mental health support through Young Futures hubs, which are a variation on early support hubs, but there's only been a very small amount of funding put in place for that. So 2 million to cover 8 pilot sites, which doesn't feel like that meets the scale of the need. They've also put a very general commitment there about generating solutions to the mental health crisis engulfing our young people. So there's not really a clear sense of what that actually looks like. But again, that's something we'd very much welcome. There's also commitments around accessing, ensuring that young people can get access to specialist mental health services, more staff to reduce long waits. The Department of Culture, Media and Sports is going to be publishing a physical health strategy very soon, and also a national youth strategy. There's also going to be work to ensure children with the most complex needs in residential care can get the treatment and support they need to avoid hospital admissions. And then more broadly, action on smoking cessation, obesity, diet, alcohol, air pollution and active travel. Now, we know these are all areas that people with mental health problems and people, particularly with people with SMI, could really, really benefit for. But we do need to see a tailored approach for that group to make sure that they benefit from that kind of action. And finally, onto the digital, the third shift. So there's a big push for the NHS app to be used much more as a kind of default setting for how you interact with the NHS more broadly, and the possibility to do self-referrals to talking therapies via the NHS app. There's a commitment to prioritise mental health technologies, so things like virtual therapists providing 24/7 support for people with mild to moderate needs, and remote monitoring for people with more severe mental illness. This is the word I stumble across every time I have to say it, but they're going to be using pharmacogenomic insights into mental health prescribing. So that's about tailoring medicines to people's individual kind of genetic profiles, so that potentially you could reduce the amount of medicine you have to give to somebody in order to have a kind of therapeutic effect. So that would mean people would potentially get fewer adverse effects. And finally, there's a commitment around new digitalised tools, digitalised therapies, and real-time suicide surveillance to improve mental health and reduce suicide rates. So we think there's a lot of promising things in here, but obviously we get the very clear message from our supporters that not everybody wants to access digital support. It does work for some people, it doesn't work for everyone. So we need to make sure that people have always got a choice in how they access mental health support. The government is saying the new neighbourhood health model is the key to delivering the new shifts. So multidisciplinary teams providing digitally enabled, person-centred care close to where people work to prevent hospital admissions. So again, this is actually very similar to what we've done in mental health services for many, many years. The early focus on a lot of the neighbourhood health is on supporting frail older people who may have multiple long-term conditions. We think there's a real role for mental health in supporting those people as well. We know they have mental health needs, and we know that where those needs are met, then they're better able to engage with treatment, that in turn makes their physical health better, and then also saves the NHS money if they're being supported properly. So there's a real need to push for kind of real integration on that work. So I think this is my final slide. If it's not, then there'll be one more. So the government published the medium-term planning framework, which is basically the old planning guidance that used to be published every year, normally just around Christmas, sometimes at Christmas Eve. This year it's come out very early, and it's covering the next 3 years. So it gives the system much more stability in terms of being able to plan for the future. So they've promised a new approach to mental health, working with NHS mental health providers and led by a new national lead for mental health, replacing Claire Murdoch, who those of you who've been around for a while will know is the National Director for mental health for nearly a decade. So again, we see a lot of those priorities from the 10-year health plan, as you'd expect, reflected in the priorities that have to be delivered in the next 3 years. So for next year specifically, taking forward the coverage of mental health support teams, setting up the local mental health emergency departments, continuing to roll out and expand access to NHS talking therapies and individual placement and support. So there's been additional funding from the Treasury for those because they've been scored by the Office for Budget Responsibility as being potentially helpful in improving the level of economic activity. So the government's been very, very keen to put money into those. I think there's a sense that perhaps we're kind of getting to the point where actually we need to look at mental health services more holistically. But for the time being, then there is that additional funding that that will lead to expansion of those services. There's also a commitment to reduce inappropriate out-of-area placements and locked rehab inpatient services, and to reduce the longest waits, as I mentioned, for CYP community mental health services. Finally, there's a section on making the most of productivity opportunities, particularly around contact with children and young people, but also reducing average length of stay in adult acute mental health beds. And then finally, for mental health practitioners across all providers to undertake training to deliver care in line with the Staying Safe from Suicide guidance. So that is my final slide. So I'm now going to pass over to Louise.
Just before I come on to this, Vicky, Charlie popped a question in about the zero waiting time standards, and she said, "Do you think that's because they knew they could never be met, or do we think it's more about not caring?" Just wondered whether you wanted to share thoughts on that or come back to it at the end.
Yeah, I can quickly say something. I think it's been, I think there's a recognition that it's going to cost money to do this. Some additional money was put into the system as part of the long-term plan, which ran from 2019 to 2024. So there was an extra 2.3 billion. And the government just didn't budget enough money to deliver those. That gave us a certain expansion of services, but there just wasn't enough money in the pot to be able to deliver those waiting time standards. So I think there has been a sense over the last few years that both this government and the previous government just aren't prioritising mental health at all, probably in the period post-pandemic, which is kind of ironic because I think the pandemic more than anything brought into focus, the urgent need for mental health support, particularly for young people. So I think it's been a very kind of constrained financial environment, but where there has been extra money, it's very much gone into those physical health waiting times. So things like hip operations, cataracts, knee operations, those kind of things, because those are the things that, to be honest, the newspapers report on a lot more, and there's much clearer data about what those waits are. So it's always seen as a bit more of a political priority. And I think particularly some of this conversation around overdiagnosis, and are we over medicalizing mental health? That's been really kind of damaging in terms of us being able to make the case and say, the increase in demand is real and we need waiting time standards so people can kind of get the support they need quickly, because we know if they get help quickly then they recover better. So in my view, it's a lack of political will at the moment.
Thanks, Vicky. Okay, so thinking about the medium-term plan and some of the clear directions of travel from government, just thought I'd have a quick reflection on what services we know that local minds already deliver. Just going to say these are only a couple of examples. There's loads of services across the network that I haven't name checked, and hopefully we'll have some time to discuss them and work with the network going forward to showcase their services to their local NHS organisations. So the one that is coming through is CYP services, which is a relief. If you were in this morning's session, we know that there's a real crisis. So it's good to see that it is in the medium-term planning document. We know there's over 45 local minds that deliver a whole range of CYP services. They're just an example. I focused on the hubs just because of the Young Futures hubs that we're waiting more information on at the moment. Vicky's talked to it, and Tolu's with us now in this session, and she knows a lot more about it. But we know that there are 8 pilot sites going to be piloted across the country. And we're hopeful that there will be hubs in every single community across the country, but we haven't got that in writing yet. But there are some examples of hubs already being delivered by local minds, and it's great that Helen is on the call from Lancashire Mind, because they're one of the pilot sites from a previous programme. There's also the reference to CYP and crises, and there's a framework on connecting minds. And Tim is also in the session today from the Service Design and Development team. So any questions about the models on connecting minds, please do ask Tim. So next slide, please, Vicky. Sorry, I can't move them on. Is that all right? Thank you.
That's fine.
So
I'm not as efficient as Chris Whitty's assistant, but yeah.
So we know there's commitment to the mental health support teams in schools, and we know that local minds are already delivering this model. So there's one online, and that's based on the service being delivered by Mind in West Essex. So if you're interested, go on to Connecting Minds and have a look at it. But local minds are also delivering hybrid models. So you can see that Teesside Mind have adopted the whole school approach, supporting not just young people, but also parents and training teachers. And although West Essex, I think, is quite a purist MHST service model, Teesside Mind operates in partnership with other organisations, demonstrating a collaborative model. And the point about it being well suited to larger commissioning footprints, we're particularly in regional influencing, we're particularly keeping an eye on that as we're seeing some of the ICBs cluster together to see if commissioning is going to go across wider geographies, or some of the other services, will it get even more hyper-local into a neighbourhood model? And then we know that lots of local minds deliver as part of MHST. So we've got Togs Mind, Hull and East Yorkshire, and Mind in Harrogate. Now, fortunate to speak with the Chief Exec of Mind in Harrogate recently about how their in-school support offer works alongside the MHST offer. So MHST is a bit of a purist model, but there is some flex in what individual schools might want to do in this area. Next slide, please. I feel a bit silly saying that. Thank you. So big commitments are NHS talking therapies and the IPS model. Quite a lot of local minds already deliver NHS talking therapies. There's some examples on there, and a couple of service models online. When Mind have campaigned on NHS talking therapies in the past, it's always to have flexibility within the model, to have access to a wider range of services. And then the IPS model, there's an example online, and I think that's drawn on Leeds Mind. That tends to be they tend to be the local mind that we speak with about their IPS model. Next slide. Thank you. Yeah, now reducing inappropriate out of area placements. So thinking about the kind of services that the network deliver, and these are just a couple of examples. There's so many more. Just using these as a prompt for us to have conversations in a few moments. Is how do we reduce bed occupancy, to be honest, because by reducing bed occupancy within area will reduce absolutely inappropriate out of area placements and out of area placements full stop, because we know that does not aid people's recovery, being away from family and friends support. So some of the services that local minds deliver that assist discharge out of hospital, one example is Birmingham Minds Discharge Navigator service, and then also keeping people well within the community and at home. There's just another example, Northamptonshire Minds Hospital at Home service. So like I say, there's loads more examples across local minds, but hopefully that just gives a bit of a flavour of what's being currently delivered across the network. I think that's it.
Okay. So we're going to move without further ado to our breakout session. So we've got Ed from our comms team who's going to do some magic with putting people into groups. There's 3 questions that we want you to discuss. The first one is thinking about the national priorities on weights that Louise and I have talked about. So the weights, the 3 shifts and the medium-term planning framework. What are you as local minds currently delivering, or what could you deliver that would speak to those priorities? Now, I know not everybody on the call is from a local mind, but if you have ideas about services that you're aware of or things that you think local minds could be doing, then obviously everyone's thoughts really, really welcome. The second question is around what makes local minds unique in what they can deliver for local communities. What is it that we do better than the NHS, maybe better than, dare I say it, Rethink or other voluntary providers? So really trying to identify the things that are really special about local minds. And finally, what are the barriers in your area to local minds being able to play their role in addressing those national priorities? And we know from our conversations from local minds, it's a really, really tricky environment at the moment. And so we'd really like to hear about, what are the challenges you face? What are the things you'd like us to raise when we talk to the national decision makers about, trying to create a level playing field so local minds can really be part of the transformation of the NHS. So I'm going to stop sharing for now, and then I'm going to let Ed work his wizardry. Button has been pressed and we're all back in the main room. So first of all, apologies for the slight musical chairs at the beginning. We were just trying to make sure we had one group where it was just people from National Mind, and much as we love talking to each other, we really wanted to hear from the network a bit more, so we did a bit of a shufty around. So apologize if you were kind of cut off in mid-flow. Maybe if we could just get a little bit of feedback from the 2 groups. Patrick, are you able to feedback on the group that you were in?
Yeah, our musical chairs group had a great discussion. Firstly, we just talked about what it was like to hear all of that information, Vicky, that you were getting across about, so much information and it beautifully condensed. But what's that like to hear that waiting lists are very long, that mental health has not been prioritised, that the NHS's thinking hasn't been addressing mental health in the way that we would want it. And we had quite a discussion around that. And people talked about the way that the changes in stigma meant that people's experience was that discussions about mental health were much more likely to start, people were much more likely to talk about their mental health, people were much more likely to seek help. And so it's really tough when you see quite how tough it is to then get help, having made that step forward. And then we went down a fantastic rabbit hole all about digital and the shift from analog to digital and what that might mean for the way that people receive services, the way that local minds might have to adapt, the pros and cons of receiving services virtually rather than in person, the kind of very strong qualitative aspect of the in-person service that meant a great deal to some people and to some of us. So we had a great discussion about the shift from analog to digital, which isn't just about actually the services that we receive, but the way that people find services. We got on to talking about the NHS app and maybe the need for local minds to be positioning themselves so that they can get referrals through the NHS app, if that becomes in a couple of years the default way that everybody accesses services. So yeah, it's a really rich discussion particularly about that shift from analog to digital and what it might mean and some of the challenges and worries that we have about that.
Thanks, Patrick. And from the other group, Louise, were you in that group from the get-go, or?
Yeah, we had a little bit of musical chairs, which was quite nice because we heard all different voices coming in and out. So we talked quite a lot about CYP because we had 2 CYP experts in the group. So we had Helen who joined us from Lancashire Mind, and we had Catherine from Manchester Mind. And Catherine was talking about they also deliver MHSTs as well, which was great to hear. And obviously Lancashire Mind, as I mentioned as one of the examples, they deliver CYP hubs models. and what Helen shared. In fact, Helen, do you want to come in? Because I think you made the point really well about hearing what Vicky shared this morning, how you were going to go back and speak with your CYP colleagues. Are you happy to?
Yeah, sure. Yeah, so I'd made a note for myself to kind of speak to our head of CYP services just around understand, because so I'm head of development, so I kind of oversee kind of all of our fundraising and bid writing and service development, but I'm not necessarily kind of fully in touch with exactly what happens on the ground all the time. So I was wanting to understand from our team what we're doing to make sure that the service we offer, obviously our focus is on supporting young people around mental health, but what are we doing to make sure that we're also being able to support around things like that have come up obviously in terms of factors that impact on mental health, like employment, like housing. So I wanted to understand from them like what who are we working in partnership with? Because I know that we do have strong partnerships with other organisations, and how is that working in terms of us signpost either supporting people directly ourselves or signposting to other services in the local areas where we've got the hubs, because I think that's a really important thing to make sure that we are connected into the right places and that we can kind of show a collective and collaborative approach to how we position ourselves to be able to be the best people to offer the service, and recognizing that we can't do all of that ourselves, that we need to be able to make sure that we're linked in with other organizations within the sector to kind of make sure that we're as strong as we can be in terms of what we're offering. Thanks,
Helen. And Catherine, who's just down the road in Manchester, was saying really similar, and then comparing the differences between two areas that do abort. And Helen had come from Manchester in 2013 and into Lancashire, and about the nuances, and this feeds into a barrier. And one of the barriers is actually partnership. It's the kind of stuff that we in regional influencing pick up a lot, the importance of working as part of the wider system. And there's two main barriers that came through. Number one, and Vicky, you're gonna feel like pulling your hair out. It's the same old, same old. It's the stat providers not treating the VCSE with parity. Both local minds experiencing that, which is so utterly frustrating, despite both local minds giving evidenced outcomes, showing how the services they deliver keep people well, reduce GP waits, all the kind of stuff that we talk about all the time. The other things that came through, which we pick up in regional influencing, and Helen spoke to us about how the ICB is internally navel gazing at the moment. But then we thought about, okay, so let's assume this all calms down, then what? And both local minds have services ready to go that they can try and pick up the conversations, because guess what? Another barrier was funding. And that is just coming through the time and time again. And also competition. So we've got the stat providers not treating the VCSE with parity, and at the same time competition from other VCSE organisations and large nationals who are coming in and just delivering cheaper. Unfortunately, that happened within some of the MHSTs. And then, Helen, what you said about what makes local minds unique, and Catherine said exactly the same before you joined, is the fact that you are so close to your communities. You've co-produced your services with them. You know it's what they want because they're listening to you. But then you've got commissioners coming in and the services are being lowballed, and then the services are going there. But I think it'll be really interesting to see the outcomes specifically of those MHSTs being delivered by the, is it a regional wide provider? How well embedded they are within the wider mental health system. Go on, Helen.
Yeah, I was just going to say, so it's a regional provider who hadn't previously delivered, as far as I know, any services in Lancashire. So obviously it was kind of frustrating to see them coming in to do that. And obviously we're in the process now of potential rollout of MHSTs. I should say we are currently commissioned to offer a service in schools for the schools that don't currently have an MHST. So at least we have a foot in the door in terms of that. But yeah, it's about making sure that when future MHSTs are commissioned, that we're kind of able to position ourselves in a good place to kind of go for that. And
then the other service that I think is worth flagging, I got really giddy because Manchester Mind were in, and I know about one of the services that they recently proactively pitched to their ICB in partnership with GADAM, which is the organisation where Ben Worley, who used to work at Mind, is CEO. They went together because they knew that getting people out of hospital and supported to stay well in the community was a challenge for GMMH, which is the hospital trust in Manchester. And they are at the really early stages of that service. And from speaking with both Elizabeth, Chief Executive of Manchester Mind, and Ben from GADAM, so far the results coming through look pretty positive. So, and I think that might be Tim. I think service development design might be on it, as I think you probably know about the service, but I think that would be a really interesting model for sharing with local minds across the network as something that speaks to the priorities coming through the medium-term plan.
Just on that one, so we did have for 2 years, it was called Bridge to Home Service, and it was doing exactly that. It was supporting people in hospital to be able to kind of sorry, excuse me, phone ringing. Yeah, to be able to kind of transition back into either their own accommodation or into supported accommodation, and it was working really well. We had some really good results, but unfortunately the funding didn't continue for that.
Just an addition on this, I guess an opportunity that I think has been around for quite a while, and in the way that we sort of we see as an organisation and a federation, early intervention and prevention, is to sort of reframe what waiting means. And I guess, you know, at the moment it's sort of seen as dead time, that we're not doing anything. And I think actually if we can reframe that into active recovery preparation, you know, I guess, you know, that we can then, and that's where our local minds can really step into this space with a variety of different offers and say, actually, you know, this isn't waiting, this is a part of the healing journey, part of the healing pathway, and that we are in that space, and that we can cover this space for you, and therefore we don't see it as waiting. We see this as an active part of recovery, and as part of that sort of these initial rungs on the ladder of what you provide. And I think that is a major reframe that we can offer to the NHS and to government as well, and say, actually, stop calling it waiting, call it something else, call it part of the journey, please. They're not waiting for anything, they can get support in this period. I think that's a real opportunity for local minds to come in with all sorts of different service offers in this space. And I also think, I mean, and a final point, we talked about digital a lot. I think that, you know, local minds are really well positioned, particularly in terms of design and development work, to really ensure that any digital offers are grounded in what people want and need and are impactful. And I think local minds can bring, you know, within our design and development sort of values to the, you know, to NHS partners, that we can really bring in that lived experience voice about making sure that those things that you provide there are grounded in what people really want across various different things. So I think that's another thing that local minds could do.
Yeah, and that's definitely the message that we're getting for government, is they do want to look at ideas for what we can do while people are waiting, that isn't just kind of waiting. Absolutely. Okay, all right, well, I'm going to draw this session to a close. I just want to say thank you so much for everybody who came. I hope you found it useful. The conversations that I ran were really interesting, and lots of kind of food for thought for us in terms of thinking about our national work. We've taken notes from the session, so we'll pull those all together and kind of really chew on those, and use them, as I say, to inform the kind of next stage of our policy and campaigning and our kind of regional influencing supporting work. And thank you very much to all our facilitators who came along. It's been really great to have you here and have you supporting the session. And all I can say is I wish you a very good the rest of your Tuesday, and hopefully see you next year at FedFest.
Thanks, Vicky.
Bye.
Thanks, Louise.